Innovator and best-selling author Stephen Johnson said, "This is not the wisdom of the crowd, but the wisdom of someone in the crowd." We're privileged today to listen to a maverick whom I refer to as the healthcare consumerism catalyst, David Goldhill, on Red Hot Healthcare. Let's go.
3 alarm at 21 and north. All engines respond.
This is Red Hot Healthcare. Interviews with today's leaders and all the news that matters. Here's your host, Steve Ambrose.
Hello and welcome to the show. I'm your host, Steve Ambrose, and you can subscribe to Red Hot Healthcare on iTunes, Stitcher, and other podcast directories. Every Tuesday, you'll get healthcare news and my takes. Each Thursday will be at least one engaging Red Hot leader interview. And we love to hear from you. Just send your comments or questions to steve@redhothealthcare.com or hit me up on my Twitter handle, PolymathSteve. Today's show is being sponsored by Medisend, any size medical office, facility, or hospital. Let Medisend analyze your current medical waste services and fees. You can remain with your current waste vendor, and Medisend will lower their ongoing fees to you. Medisend gets paid only if you save. Or switch your medical waste services to Medisend. They often save new clients up to 30% or more off current vendors, and fees remain level from year to year. Just go to redhothealthcare.com, fill out a few fields, and your information will only be sent to Medisend and no one else. Guys, I can't do any better than this. Medisend is good people with great intentions. Save with Medisend today. And now, we're ready for the show. David Goldhill is the president and CEO of the Game Show Network. Its television and internet entertainment channels, reaching nearly 80 million American households. Perhaps his greatest influence has been in sparking thought and clarifying an understanding on the problems inherent within the design and function of our American healthcare system. His 2013 book, Catastrophic Care, won critical acclaim, leading to his many speaking engagements and praise from notables such as Malcolm Gladwell, numerous health policy think tanks, as well as articles in the New York Times and Washington Post. David, welcome aboard Red Hot Healthcare.
Thank you, Steve, and thanks for having me on.
I have a tremendous amount of respect for you, David, and for your book, Catastrophic Care. It transformed me and my mission, and I know that for many of the people I'm connected with in healthcare, especially on the leadership end, I know it transformed them as well.
Well, that's very kind and flattering. Thank you.
You wrote the book, not seeking any personal accolades or praise, but really to honor the memory and the unfortunate passing of your father, who died from medical negligence. Many people, certainly people that I know, would have internalized this type of event and maybe become bitter, but you decided to step back and take a macro view of the entire system, really a system that's rigged largely to benefit mostly the business players within it, rather than the actual consumers that keep it up and running.
Well, I think for me, my father's death from a hospital-acquired infection was my real first meaningful exposure to the healthcare system. Both my father and my sister are physicians. I've had relatively little involvement other than the sort of normal medical procedures you have. And it was eye-opening what happened to my dad. I was not aware, I think most Americans weren't aware, just how prevalent the rate of error and often fatal error is in our healthcare system. And so that was the first sort of shocking, eye-opening reality to me. When you go through this with a loved one, you mentioned internalizing it. It's a terrible experience. Obviously, there's an extraordinary amount of grief and personal emotional reaction. A couple months later, when I understood that what happened to my dad was relatively common, a somewhat different feeling started to crowd into my mind, which is, how is that possible? We have an extraordinarily high-tech healthcare industry. We have massive amounts of government oversight. The issues they deal with are life and death very frequently. So we've got people experienced in that. Almost everyone I know in the healthcare system, really regardless of what they do, is interested in the welfare of patients. How do we have a system that, by the most recent academic estimate, kills 250,000 people a year through avoidable accident? And that really was the starting point for my interest in taking a sort of larger overview as to what the real factors affecting healthcare were.
Yeah, and you call healthcare an island that doesn't respond to the same economic laws as other products and services we have in our country. So I'd like you to, for our audience, explain that concept that healthcare is its own island.
Well, I think from beginning to end, almost everything about healthcare functions differently from anything else in our life, right? So we have other necessities that we're used to buying, food and shelter and clothing, and healthcare operates like none of those human activities. No other emergency service does it act like. Of course, the way we and other societies have chosen to organize it, with very heavy government involvement, either directly or through mandated actions by insurers or other private parties, we've created a healthcare economy that resembles nothing else we've seen. What I do talk about in my writings is how a lot of that structure is actually based on things about healthcare that were true 100 years ago or 50 years ago that are no longer true. And when I refer to the island, it's actually an intellectual island. It's a view that healthcare is so different than other human activities that what we've learned in other human activities, how important individual consumers are, how important competition is, how transformative information technology and mobile communications can be, in none of it do we seriously apply those lessons to healthcare. And frankly, one of them is how government can be effective as a regulator. Another thing we don't really apply to healthcare. And what's interesting to me about the island of healthcare is it's really the only way to understand how some incredibly smart people who genuinely care about people's welfare can be promoting continued behavior that fails us. Fails us in terms of value, fails us in terms of quality, and of course, in the case of my father and so many others, even fails the basic test of safety.
And you said that complexity is not inherent in healthcare, but it is inherent in how we built our healthcare system. Complexity has become an excellent generator of revenue for the health sector industries, but it's really been detrimental to the healthcare consumer.
Yeah, Steve, there's a comparison I like to make. In 1965, the year Medicare and Medicaid was passed, the first commercial mini computer was also created. Now, this computer, the PDP-8, wasn't designed for you and me. It was designed for a company managing its payroll. And at $18,000 or $19,000, the price of that computer was much, much more than the average person could afford. That year, the average American spent $225 a year on healthcare. So this computer was 80 to 90 times the cost, but it was the first time somebody had built a commercial computer that didn't require a PhD to operate. Fast forward to today. The computer industry has somehow figured out how to get one of the most powerful, extraordinarily capable computers in the hands of my mom. And they figured out how to get her to use it so that it's important for her day-to-day activities, how to rely on it, and how to find it easy. In other words, in going from their customers being NASA to big companies to small companies to professionals, all the way to grandmothers, that industry has figured out how to take the most complicated thing ever invented by human beings and make it so simple that your mobile computer, your smartphone, doesn't even come with instructions. Compare healthcare. The most personal and often important service we receive in those 50 years has gotten ever more complex. Trying to understand how the industry is organized, where you go for care, trying to coordinate care amongst professionals who themselves are not coordinated, trying to navigate a hospital. And that's before we even get to the ridiculous complexity of trying to understand what your bill is has gone in exactly the opposite direction. Now, if you live on the island of healthcare, you think that's because healthcare is so complicated. If you live in the mainland, you understand there was something important and different about what occurred, by the way, not just in the computing industries and mobile telephone industries, but in all industries that enabled them to figure out ways to make things that we previously thought were complex simple, while at the same time healthcare, which needs to be simple, straightforward, and understandable in order to work, has become ever more complicated.
And one of the complexities that you touch on in your book and in your new book as well, which we'll get to, is just how non-transparent healthcare is to us, the average American worker. You have a stat in there which floored me. The average American worker puts nearly $1.2 million of their own money into healthcare over their lifetimes. And I think that number, as you alluded to in off air, was even higher with inflation. But this really seems staggering, David, especially it goes largely unrealized by the average consumer. So maybe if you could help us to understand and explain a bit to us how that happens.
Well, I mean, first of all, the whole system is based on hiding from you what you're actually paying for care, right? So there are people who say, wow, thank goodness I didn't have to pay that $50,000 bill because I have insurance, who are paying $15,000, $20,000 a year for insurance. They'll pay that every year of their lives to avoid one or two $50,000 bills. That makes no sense. But the deception is even deeper. It's core to the system. So we've built up this huge structure of ways to protect ourselves from becoming too old, too poor, too unemployed, too at risk to pay for our own care. And in protecting ourselves against all those things, we bizarrely wound up charging ourselves far more than we could ever pay. The example you're referring to, Steve, when I wrote my book, I looked at what a young woman starting work for our company that year would contribute into the system over her lifetime based on a few assumptions, right? That, she gets married, she has kids, she retires, she goes on Medicare, she lives to 80, and she's never really sick. And I looked at everything. Her share of the insurance premiums, our share of the premiums, because as every economist will tell every misled American worker, the premiums are coming out of your pay, whether you know it or not. The share of taxes that supports Medicare and Medicaid and all the other ways we have of protecting people against healthcare, her out-of-pocket, her Medicare premiums, her Medicare taxes, the number of ways in which the healthcare system has a hand in your pocket, often that you're not aware of to provide the safety net, is extraordinary. So, and I just added it up. I didn't use inflation. I didn't use cost increases. And what I discovered is this woman, assuming she never gets rich, she's just middle class her whole life, normal income growth, will put $1.2 million. If there's any inflation in the system whatsoever, and obviously there's meaningful inflation in the system, I said, let's just take the projected 10 years of inflation under Obamacare. That's $1.9 million. If she's married, has a working spouse who's also has income, $2.5 million. Why do those numbers matter? Because there is probably for our young people looking forward at their future, no bigger financial hurdle we've created for them than the need to fund this healthcare system. It's 18% of our GDP, which means if you're working, it's got to be a higher percentage of your pay. And it's all designed to do this one absurd thing, which is try to convince 100% of the population that they personally are not paying for their own healthcare, someone else's. It's an absurdity on its face, and keeping the absurdity, keeping it non-transparent is what lets, some 22, 23-year-old woman starting her first job not understand that the major reduction in her income over her lifetime is going to become what she doesn't know she's paying for healthcare.
From your book, you state, and I'm going to quote this here, the most important single step we can take towards truly reforming our healthcare system is to move away from comprehensive health insurance as a single model for financing healthcare. A guiding principle of any reform should be to put the consumer, not the insurer or the government, at the center of the system. With that in mind, Take us into the problem, if you could, David, with today's third-party payer system, and maybe some emphasis on how it actually functions different from real insurance.
Yeah, I mean, I think that's a crucial point. Look, it's very popular for people to talk about how irrational the healthcare industry is and how irrational the services are because they see bad and inexplicable results. I take the exact opposite approach. I assume, like every industry I've ever been in, and since I have trouble holding a job, I've been in a lot of industries. But I assume that, like every industry, fundamentally what we see in healthcare is a rational response of providers to the incentives provided by customers. What we don't understand is that the customer of the healthcare industry isn't you and me and other patients and family members. The customer of the healthcare industry is insurers and government, mostly CMS, which runs Medicare, and the local state Medicaid agencies. They are the customers. They don't just, by the way, pay the checks. They determine what services you can have and can't have and how each will be charged. They are extraordinarily powerful customers. And my argument is everything you see about the healthcare industry that you find disconcerting, whether it's persistent high prices, terrible coordination, poor record keeping, sloppiness, excess, and danger, is in response to the incentives and disincentives those customers create. The reality is, if we were the customers and hospitals were trying to get our business, it'd be awfully hard for them to kill 250,000 people a year by accident. They can only do it with the government as a customer and insurers as a customer, which have a different set of needs. Okay, how do we change that? Well, we can't suddenly say, let's get rid of third-party payment. But we can recognize a couple of things about third-party payment. One is, unlike in other places where it's intended to be a safety net, it's not really functioning that way anymore. The example I use is you have a house that's worth $250,000, and you insure it in case it burns down. What you're going to pay in premiums is a fraction of what the house is worth because you're sharing the risk with all the other people who own homes and are afraid of their burning down. In healthcare, we're doing the opposite. In return for paying for the extraordinarily high health expenses, we now all will bear over a lifetime, although at different times in our lives and often unpredictably. But in return for the certainty that we will need this money, we pay premiums well in excess of what it would cost almost all of us to fund our care. It's the equivalent of saying you have a $250,000 house and you're paying somewhere around $750,000 to protect against the risk of that house burning down. And one of the reasons we're overinsured is because we insure against certainty. We all know we're going to need a certain amount of healthcare services over our lifetime. No matter how healthy you are, there's something you're going to need. And with the extensive amounts now spent on end-of-life care and chronic condition treatment and almost 100% of seniors having chronic conditions, the reality is all of us are going to spend a meaningful amount of money on healthcare over our lifetime. Running the certainty through an insurance system adds to it all of the administrative costs of insurance. And the example I always like to use is, let's say someone offered to pay for your groceries, but when you got to the checkout line, you had to call an adjuster to make sure everything you buy fits your policy. That's what we've done in healthcare. We've added enormous amounts of administrative cost to everything. The estimate now is the administrative costs in the system may be as much as $300 billion a year. In other words, $1,000 per American. It's an unbelievable astronomical number. But you also add complexity. I can't just buy something. I read this post the other day online in which some guy said that his wife had a stroke. He called his insurer, and the insurer said, call 911. How crazy is it? We've now actually gotten to a place where your wife has a stroke, and you first want to make sure your insurer covers it. Well, that's who we are. And so we've added all of that cost and all of that complexity. What I'm saying is, look, you're never going to transform this system overnight. Let's do what we've done in other industries. Let's find a corner of it in which a normal industry can start to develop and grow that. And what's great about healthcare is there's so much money in it that we should be able to do it. Let's reduce the coverage of insurance, getting it closer and closer to those things that actually can be efficiently insured, which is unexpected, major, unaffordable healthcare. And let's be shrinking that coverage at a time rather than expanding it. Use the enormous amount of savings we'll have on premiums and the associated administrative costs, get it back into people's pockets. That changes everything about healthcare because suddenly providers have to do what computer companies had to do, which is to figure out a way to make their services accessible to my mom.
And now, a few words from your host. We'll be back to the show in less than a minute. I get email from listeners that want to know what I do. Hey, I'm a consultant that works in 3 areas: patient engagement, influencing healthcare consumers, and persuasive communication. Don't think for a second that just because you created or use some whiz-bang technology to lower chronic disease rates or capture patient-generated health data, that patients are going to raise their hands, open their eyes, line up, and get with your program. If you're treating patient engagement as a head-nodding, getting them to agree tactic, don't be surprised when they close you off. I was a provider for nearly 10,000 patients. I saw as many as 50 encounters a day, many of them self-pay and properly engaged on long-term care management. I also served in strategy and customer communications for a tech company serving millions of needy customers across the country. I know what it takes to reach patients, consumers, and the people that support them. I'm happy to chat. I'll let you know if and how I can help. Just email me, steveambrosucla@gmail.com. And now, we're ready for the show. When people say, well, we ought to just make it a single-payer system, and, it would just be so easy to do it. We should be just like Canada or just like Denmark. I don't think that people understand just how big the health system is and that everything is so interconnected. 50 years ago, we didn't have public companies that had major shareholders and that had to drive quarterlies and to show continual profit to keep their shareholders. And now what we have is a system that by the end of this year is going to have the largest employment pool of any sector, including the government. It's going to surpass the government in terms of employment pool size. And if something has grown too large, David, something's going to have to give. I wonder if healthcare has just grown too large with what it has as its infrastructure. And even though the change for the future generations is needed, that there's a lot of hesitancy because something's going to have to give, whether it's going to be people losing their jobs, whether it's going to be companies going out of business. But if we don't start doing something to change it, it's going to be unsustainable anyway in terms of transformation. Maybe you can speak on that a bit.
Yeah, I think it's a really interesting point you raise. One of my favorite economics laws is Stein's law, which says that unsustainable trends end. And I think you're right. The growth of healthcare is unsustainable. We're looking at the potential for healthcare consuming $1 out of every $4 the economy produces. And what's interesting is that healthcare itself is a relatively small contributor to people's health relative to the other 75% the economy produces, particularly when we talk about disposable income and education and lifestyle and leisure and nutrition. Those things are all far more important for our health than healthcare, and yet healthcare is where all the money's going. I think you raise another thing that's unique about the United States that most people who call for single payer don't really appreciate. And a lot of people's knowledge about single payer is based on, I think, fairly dated information about how many of the other systems work around the world. Almost all systems of healthcare finance are struggling. I like to joke that the United States has the greatest hits of healthcare finance. We have a single payer system in Medicare. We have a mandate for private insurance. We have a directly provided care in the VA. We have a government-run insurance safety net in Medicaid. We have within our system almost every system that exists on Earth.
Right.
We are missing one element, though, that is so crucial to the functioning of those systems. And it's best seen through Medicare, which is single payer for seniors. Every other healthcare system in the world accepts that the payer has a right to limit the amount of care received. Most people don't know this, but the British healthcare system has a budget. So do the Canadian healthcare system. You can't spend more than that. You literally have to allocate care to hit the budget numbers. In every European system, and there's a wide variety of hybrids, there's a federal budget or a state budget or an insurance company budget or even a hospital budget that is an actual amount of money. Most people don't think about this, but what makes American healthcare unique is that our politicians have sold it to us on the basis of this system should be able to pay for all the care you need without limit. So Medicare and Medicaid are entitlements. Insurance regulation prevents insurers from doing much to ever limit the volume of care demanded or received by its customers. And in fact, politicians have never been honest, they may be unaware themselves, that while need sounds like some sort of objective measure, well, all the healthcare we need, what could be wrong with that? The industry has responded the same way I would respond here if Congress said America can have all the game shows it needs. I would constantly be trying to increase Americans' perception of how many game shows we need. And the healthcare industry does that. The definition of need expands infinitely. There is no limit on it. And as a result, our single payer system, which is Medicare, performs terribly relative to the ones it's supposedly based on. Medicare, as you know, doesn't limit care at all. So it is probably the primary driver of the enormous amount of excess care. And of course, this excess care is received by our most vulnerable population, seniors. So when we talk about single payer, we have never honestly said that any healthcare system is about limiting supply and demand, which everyone else has done, and which I don't think there's any political support for here at all, which is why I don't think single payer will work here. And then the second point which you raised, which is really interesting, is that the American healthcare system is enormously open, like everything in our system, to politics. We have healthcare providers who lobby Medicare all the time about what Medicare should be paying for and how much it should be paying and how its services should be expanded. The single-payer systems that work around the world don't have nearly the political responsiveness that the American system has. And so what's interesting, as you point out, now that healthcare has become our biggest employer, the more power we give the government as a buyer, the more likely those buying decisions are going to be made by our very responsive, very lobbying-driven political system. I'm not sure that's such a great thing for our health.
In putting decision-making back into the hands of the consumers, which you advocate very strongly in your book, you suggest a solution that would truly help to get the system back on track. And I'd like you to go over that on a high level for our audience.
Well, I think the best thing we can do is try to get as many of the dollars going into the system now to wind up in the hands of consumers through health savings accounts. That's the best tool we have. At the same time, we want to encourage those people who are willing to, preferably earlier in their life, to sign up for insurance as catastrophic insurance, not covering absolutely every service, but rather only those that are so major and so expensive that you need normal insurance protection, just like you do if your house burns down. We want to start young people on that approach to the insurance system. We do need to recognize it took 3 generations to get us to this awful point. It is going to take some time to get this right. But here's the power of this. Here's the power of this. Our entire provider system, from hospitals to clinics to physicians to pharmaceutical companies, is based on serving this third-party payment. The minute you get a meaningful percentage of the buying power in the hands of consumers, their incentives change. Suddenly they know they're selling to people who are obsessed with price, are going to demand service, and that they have to figure out how to be transparent enough to you that you'll buy it. The reason companies and the rest of the economy try to keep prices as low as they can and try to make it as easy for you to buy their things and as willing to engage in comparative advertising against their competitors is because that's the only way to get your business. We want to reestablish that for at least a segment of healthcare so that providers are forced to figure out a way to adjust their business models to compete on price, quality, value, transparency, simplicity, and safety, just like in everything else. Weirdly enough, if you can get the government out of the business of being the customer of the healthcare system, it's going to work far better as a regulator of the healthcare system. The government doesn't buy airline seats and has proven to be an extraordinarily effective regulator of aircraft safety as soon as it got out of the business of being the customer for the airline industry. It could focus on the things that really matter to us as consumers to have government regulation in. Right now, the government is the partner of the hospital. Medicare is the partner of the hospital sector, and as the hospital sector's partner, Medicare is a miserable and ineffective regulator.
You have a new Kindle book out, David, called The Real Costs of American Healthcare. Can you tell us if that is an update or an add-on to your prior work in Catastrophic Care?
So it's a little bit of a summary of why I think the fundamental issues in healthcare are addressed neither by the Affordable Care Act nor the passionate opposition it aroused. I kind of view the Affordable Care Act as fighting the last war based on conventional wisdom that's 50 years old. And so it's a bit of a discussion about why I believe that and what I think the real principles driving our healthcare problems are. The second part, though, is a look at what I think has been one of the more important but accidental implications of the Affordable Care Act, which has been the growth of high deductible policies and more recently a sudden spurt in health savings accounts, particularly among those who receive their insurance from employers. Basically, the Affordable Care Act said we want to make insurance both universal, in other words, everyone has it, and even more comprehensive, which means covering even services that are so routine that people used to cover them out of pocket. So it expanded insurance in both ways. And if you ask me why it has fundamentally had a problem restraining insurance costs, it's because of that, right? You would pick one or the other. My preference would be universal coverage over comprehensive coverage. It tried to do both. And it tried to do both based on the very old-fashioned and fundamentally incorrect fantasy that having health insurance means you have access to care. Having access to care means you'll be healthier. Being healthier means you'll have lower healthcare costs. None of that is true. We're getting to see, and it looks like a horizon of only 2, 3, 4 years from now, where the average privately insured, non-subsidized person is going to have an insurance policy where the first meaningful amount of money, $1,000, $2,000, $5,000, in some cases even $10,000 of healthcare spending every year comes out of their own pocket. Now, unfortunately, without health savings accounts and without the lower premiums that should have occurred with that, that's going to be a real financial burden on a lot of people, and I think already is. Over time, though, that pain will be mitigated by the fact that providers are already saying, what do I do with patients like this? They walk into my office and they have this high deductible insurance, and they ask if I take their insurance, and I say yes, and I provide the service, and then the insurer says, sorry, we can't reimburse you their deductible, and now I've got to collect against somebody whom I've never told the price to, I've never described the services to, I've never given a bill to until I collected, and by the way, I provided the service 2 months ago. You suddenly have to find a way to say, well, if you're a high deductible patient, I need to charge you. Here's what I'm going to charge you. That is a brand new, revolutionary conversation in our healthcare system, and it will stimulate meaningful changes because the provider knows there's no way you're going to pay the bill if I say, can't tell you what it's going to cost, can't tell you what the scope of services are. It could be anywhere from $100 to $5,000. I'll let you know once I send you the bill. I want to add one more point, which I think is often misunderstood. On the island of healthcare, consumer-driven healthcare is dismissed with the following phrase: who wants to shop around when they're having a heart attack? The presumption is that consumers have to work harder in a consumer-driven economy than they do in a non-consumer-driven economy. I like to say that whoever makes that statement, and every critic of consumer-driven healthcare makes that statement, has apparently never used our healthcare system. Because what makes a consumer-driven economy unusual is not that consumers do more work. It's that the providers have to find ways to talk to them, to reach them, to serve them so that consumers say yes. In consumer-driven industries, it is the provider in competition with other providers for your business who do all the work. Your work is saying yes or no, and it's much better than what you have right now.
David Goldhill, CEO of the Game Show Network, author of Catastrophic Care, and his new book, The Real Cost of American Healthcare. David, a pleasure to have you on the show today.
Thank you, Steve. Great talking to you.
You've been listening to Red Hot Healthcare with Steve Ambrose. Subscribe to us on most major podcast directories. For media or business inquiries, reach out to media@redhothealthcare.com. Thanks for listening. This is Denny Colonna. We're out of here.